I'm Dr. Corey Maas, the founder and director of the Maas Clinic and an associate clinical professor at UCSF. One of the most important things that we do for our patients before, after surgery, or even during our process of doing procedures with injectables and other non-invasive technologies is to inform them and educate them about skincare. Skincare is the single biggest return on investment type of activity than any of our patients can do. That even includes surgery, and if they do it for their lifetime, it assures good quality skin, the reduction of wrinkles and spots that are associated with the aging process, and most importantly, it keeps the skin healthy and much less chance of skin cancers and other types of neoplasms or growths of the skin that none of us want. We can break skincare down simply into four basic kind of categories. The first one is cleansing and exfoliating, and put them together because they often work together. When we do cleansing or exfoliating, we can do that depending on your skin condition, from a very gentle cleanser to cleansers that help to start the exfoliation process with light acid types of washes. And I say light, I mean very light. No peeling or weeping of the skin is done with that. And in many cases, I'll ask my patients or encourage them to use something like a buff puff or a clairsonic brush, something that will actually mechanically help dislodge some of the dead skin cell layer, which there are 50 to 100 layers of just dead skin cells on the surface of most people's skin. And we want to stimulate new generation of skin from the deeper basal layers of the skin to the surface and make the skin smoother feeling and appearing by doing this cleansing and exfoliation. The second area is treatment, and this is an area that I think has been really hyped with lots of different commercial and corporate interests, but when it comes down to it, there are really only a handful of molecules that we know actually can treat the skin and change the appearance of the skin and actually the physiology of the skin that's associated with aging and sun damage, a condition we call solar elastosis. One of the main ingredients is tretinoin, which is a vitamin A-based molecule. The trade name originally was Retin A. It's off-labeled now, or off patents now, so it's in many forms. But tretinoin is a molecule, a vitamin A derivative, that does many things in the skin cells themselves, in particular the basal layer of skin, that improves the quality of the skin division or replication. It improves the contours of the anatomy of the skin. If you look at the basal layer all the way to the skin surface, the epidermis, and the skin really has two layers, the dermis and the epidermis. The tretinoin molecule has an impact all the way through those skin cell layers, including helping with the remodeling and reorganization of collagen, which we lose the integrity of as we age. So using tretinoin, in addition to a handful of other things that we think help, are good and important parts of the skincare program. So I make sure that patients are doing the cleansing exfoliation part and then treating the skin with some type of a retinoid. So it's a broad category. Tretinoin or Retin A is one of them. If people can't tolerate that, and there are some people who have some irritation when using Retin A or tretinoin, we can use a retinol type of product, which is a little more gentle on the skin, but still has many of the same benefits. It's interesting that our skin cell nuclei even have receptors for this molecule, which really again helps to improve the organizational structure of the skin. It improves fine lines and wrinkles. It helps to regularize skin pigment and the production of pigment within the skin cells. So there's just a myriad of things that this particular molecule does, and all this data is very well established in excellent studies that were done initially at the University of Michigan and onward have been proven by multiple others. The other molecule that we found to be very helpful with the skin as an anti-inflammatory and antioxidant is topical vitamin C. It's got to be the esterized version of L-ascorbic acid when it's applied, so it's important that you look for that. But by using tretinoin, retinoids, the retinol type of products in the evening, along with cleansing and exfoliation, we're beginning a process of treatment that for most patients will make a substantial impact in their skin quality and appearance over time. In the morning, I'll have people use the vitamin C-based product. Vitamin C, the L-ascorbic acid that I mentioned, is a ester form. That's really important that it's the ester of the vitamin C product applied topically. Now, we're not taking these as vitamin pills or other supplements, but applied topically as an emollient or cream onto the skin surface It's a very powerful antioxidant, and it also has anti-inflammatory and protective effects to the skin. And I think if we're using those two molecules, we're doing about 90% of what we know actually can improve the skin surface. There are dozens of other molecules that are being studied and written about, including the polyphenols, the copper peptides. There's a dozen or more that have a growing amount of scientific data behind them. But those two core molecules, I think, should make up the basis of the treatment of the skin when we're talking about skincare. And then there's hydration. Most of the things that we see purchased over the counter at most of the skin care studios, salons at Nordstrom's or Neiman Marcus are very good hydrators of the skin, very good moisturizers, and there's nothing wrong with excellent moisturization. Moisturization of the skin creates plumping when the skin cells are plump, and they're very well hydrated. That makes the skin look smoother and feel smoother and gives it a better appearance overall. It's not actually treating the skin per se, but it is making the skin look better and replenishing that surface hydration that improves overall skin quality and tone. And I think that's an important component of it. I just don't like the idea that people are spending hundreds or even in some cases thousands of dollars for good moisturizers. And then the last component to skincare, if we keep this really simple, is protecting the skin. And sunscreens are becoming much better known now. I see these crazy SPF factors of 50 and 100 and 200. In practice, SPF is a way of measuring how your skin would perform without the sunscreen versus how it would do with the sunscreen. And it's frankly a ratio. Anytime you get above 30 or 40 SPF, it probably makes no sense because it's the equivalent of your being in the sun for 40 consecutive hours with the product versus 1 hour without. And so in practice, no one's really out in the sun for 40 consecutive hours. And in fact, most sunscreens, even the best of them, wash off in outdoor conditions or sweat off in outdoor conditions within about 4 hours. Even the waterproof ones, there's really no such thing as a truly waterproof sunscreen. So reapplication of sunscreens are very important, but the best of them contain physical blocking agents, either micronized zinc oxide or titanium oxide, along with the newer molecule that's been approved, avobenzone, which all block the UVA, the long wavelength rays, which used to be thought of as tanning rays, which we now know cause the most wrinkles and also are associated with the dangerous skin cancer, melanoma, and the burning rays or the UVB rays. So the sunscreen that you use should have a physical blocking agent, zinc and or titanium oxide. It should have avobenzone in it, and it can be oil-free if you're acne prone because some sunscreens do plug the skin. So customizing the sunscreen or sunblock, as it used to be called, to your skin and the condition of your skin is very important also. So in summary, I just would say that sunscreens are very important parts of the overall skincare program, but they're not the only part of the skincare program. We can cleanse the skin and exfoliate it. We can treat the skin with the retinoids and with esterized vitamin C, and then we can hydrate the skin with good, very good moisturizers, none of which have to be very expensive. And I think a lot of people are paying way more money than they should on a good skincare program. 4 components again: exfoliation and cleansing, treating the skin, which we've mentioned the molecules, hydrating and then protecting the skin with sunscreens are the key to long-term success and quality skin, whether you have surgical procedures or small interventions like injectables or some of the non-invasive technologies that are offered here at the Maas Clinic and elsewhere. If you have other questions about skincare programs, I encourage you to visit our website at maasclinic.com. You can write me or send me an image of your skin at our video blog, drmaas.com. And as always, we welcome live consultations here at the Maas Clinic and Appearance Care Center. This is Dr. Corey Maas on Looking Your Best.